going to be a long battle. We want to see them all move in the right direction. It's not always going to work that way, but it doesn't change anything about how we approach this. We keep fighting, we keep sticking to what's working, and we will see progress. And overall, we have. Even though these indicators have not been everything we wanted to be, we definitely see some real movement, and that's really good news. So first, the daily number of people admitted to hospitals for suspected COVID-19, well, that went down from 212 to 204. That's good news. The number of people in ICUs across our health and hospitals facilities for suspected COVID-19, that went up, but by very little, from 853 to 857. The percentage of people who tested positive for COVID-19 also went up, but again by very little, from 34% to 35%. The number of people who tested positive through our public health lab tests went down from 67% to 63%. So again, you see some progress when some of the areas going up. They're only going up by a little. Overall, we are seeing definite progress. Not everything that we're looking for to get to the point where we can relax some of the restrictions, but definite progress for sure. So keep doing what you're doing, New Yorkers. It is working. Just let's keep with it. It'll take some time, but we can do it. Now, I always want to offer my thanks to anyone and everyone who stands up for New York City. And today we're talking about great stories of New Yorkers doing things for their fellow New Yorkers, but also a lot of the time people have come to our aid so we could help ourselves. And I talked to you about surgical gowns yesterday. This is our toughest situation right now with PPEs. And it got to the point where we couldn't get. It's just quite clear the global market isn't functioning right. No matter what you try, you can't get the kind of supply that we need. But we said, okay, if we can't get the gowns ready-made, can we get the fabric? I mentioned yesterday we worked with the White House, particularly with Peter Navarro and his team, who have been fantastic. And they put us in touch with leaders in the textile and garment industry who have been really helpful. A special thank you to Kim Glass, who's one of the leaders of the industry, who's been giving us great help. They connect us to a healthcare supply company, Owens and Minor in North Carolina. And they went to bat for us. A special thank you to Chris Lowry and everyone at Owens and Minor. I was on the phone with them several times. They have already delivered, in a matter of days, they produced and delivered to New York City 1 million square yards of American-made fabric. And I want to emphasize what a refreshing reality this is, that we're not searching for something in another country that may or may not let us have it. This is American-made fabric, waterproof fabric, that we can turn into surgical gowns. So 1 million square yards already here. That will create enough for 400,000 more surgical gowns. And I have an update on the day by which they will all be produced. They will all be ready and done by May 10th. And that production is going to be expanding constantly as we create more and more of these gowns in New York City. Special thank you to folks at UPS, Laura Lane and everybody at UPS. They jumped in immediately to make sure that the delivery from North Carolina, 570 miles away, and it happened the second that the fabric came off the assembly line, it came to New York City in record time. So incredible team effort to help us help ourselves, and we're very, very appreciative. I want to say one more thing before I close. We gather today, and normally if our society was functioning as normal, there would be very solemn remembrances today because it's Holocaust Remembrance Day. There'd be solemn ceremonies, moments to reflect. And not just for the Jewish community and our Jewish brothers and sisters, but for everyone to learn the lessons of the Holocaust, to think about what it means, and to always gain strength from the incredible examples of people who fought their way through. One of the most painful realities of these last weeks is some of the people we lost to the coronavirus were Holocaust survivors. Think about that. They lived through one of the greatest atrocities in human history and then succumbed to the coronavirus. We have to learn a lesson from all of them, even those we've lost, and certainly from those who still survive. And I've met so many of them, particularly in Brooklyn and areas I used to represent the city council, where I constantly would meet people who would tell me their stories of fighting through and surviving the Holocaust, and it was extraordinarily inspirational. We got to realize that there are people right now in our city who stared down unspeakable evil, who dealt with unthinkable pain and terror and overcame it and fought through it and decided that they would not only survive, but they would create a new life with new families, new hope. They would sustain their people, their beliefs, their faith, and they did it. And some of those stories, when you're talking to some of these individuals, you are humbled. I am humbled. I know it because it reminds you of the greatness that's possible in each of us and what those who have gone before have done, and it inspires us. So we need to endure right now. We need to overcome. And we need to learn from all of those who went before, but particularly those extraordinary, noble Holocaust survivors. They're teaching us a lesson right now that we should take to heart in this moment. Lastly, the last days, I've made it a point to be very straightforward, very honest with all New Yorkers, with all of you about what we face, the fact we have a long battle, the things we can do and the things that we can't yet do. It was no fun to have to tell you that May events had to be canceled and then June events had to be canceled, including some of the events we love the most each year, we cherish, we look forward to. It's no fun to tell you have to keep social distancing and staying home, but it's the right thing to do, and you're doing it, again, with extraordinary ability. We had to say that those things couldn't happen, those parades, those concerts, those street fairs. I had to say it just isn't time for them yet. There's still too many unknowns. There's still too many threats. There's a lot we don't know. But there's one thing we do know for sure. The day is coming when this city will fight our way back, when this city will get back to normal. The day is coming when we will overcome this disease. The day is coming when I'm going to be able to tell you we can gather again. The day is coming when I'll be able to tell you, in fact, we will be having the concerts and the street fairs and the parades again. But I want to guarantee you one thing, that when that day comes, that we can restart the vibrant, beautiful life of this city again, the first thing we will do is we will have a ticker tape parade down the Canyon of Heroes for our healthcare workers and our first responders. We will honor those who saved us. The first thing we will do before we think about anything else is we will take a time, as only New York City can do, to throw the biggest, best parade to honor these heroes. And many, many great heroes have gone down that canyon to be appreciated and loved by millions of New Yorkers, but I think this will be the greatest of all the parades, because this one will speak to the rebirth of New York City. This one will speak to a kind of heroism that is intrinsic to who we are as New Yorkers, to our values, to our compassion, to our strength, our resiliency. This parade will mark, this parade will mark the beginning of our Renaissance. But it'll also be, most importantly, a chance to say thank you to so many good and noble people, so many tough, strong people. They're fighting right now, and they have to keep fighting, and we have to keep supporting them and showing them our love and appreciation. But one day, we will be able to start back on the road, and we will honor them as they deserve, and that will be a beautiful and joyous day in this city. Everyone, I want to just say a few words in Spanish, and then I'm going to turn to one of our heroes of this great ventilator effort, Scott Cohen, and he's going to talk about how this amazing effort came together. En la ciudad de Nueva York no esperamos ayuda. Aquí le echamos mano a la obra. Lo estamos demostrando de nuevo en esta crisis. Estamos haciendo nuestras propias batas médicas, máscaras, exámenes de coronavirus y ahora ventiladoras. Pase lo que pase, vamos a encontrar una manera de proteger a nuestra gente y seguir salvando vidas. With that, in the spirit of doing for ourselves and protecting ourselves, a man who had tremendous vision. And I just want to say, what an amazing thing to look at what's happening around the world and say, wow, we need ventilators. How about we create our own? What an amazing spirit, how much creativity he and his colleagues had. But that will to get it done and that tirelessness, not waiting for 1 hour, not resting for 1 hour until the job got done. So my great pleasure to introduce the co-founder of New Lab and the lead for the Emergency Ventilator Response Initiative, Scott Cohen.
Thank you. Thank you, Mayor. Appreciate that.
Thank you, Scott.
Yeah. Sort of a few words about the journey we've been on. Well, I just really wanted to say that we really wouldn't be here today without the partnership with the city. Really early on, when Marcel and Charles Boyce from Boyce Technologies and Marcel Botha, who's on the end here from 10x Beta, who's been a founding member of New Lab since the very beginning, we all started talking about the resources we had around us and the engineers and roboticists and inventors that were around New Lab, the engineers and experts over at Boyce Technologies, and we all started talking very early on at the impetus that was actually another New Lab member who was watching what was going on in Italy. He was Italian and asked us, could we help Italy? And we really started thinking about it, and we weren't sure, both Marcel and I were quite skeptical whether we could do something like this. But then when it started coming to New York, we were like, well, we have to lean into it. And so the three of us came together, and then very early on, we reached out to James Padgett at the EDC. We let him know what we were thinking about, and that we really needed to know there was some sort of partnership with the city, because this was a very risky and fluid endeavor. I don't think we ever knew at any given instance whether we were going to get this done in the time frame that we set out to, but we all navigated through it. And I mean, there were really, I'd say, hundreds of people involved in this effort. There were engineers from New Lab and from Boyce. There were engineers that reached out from other communities in Silicon Valley. There were engineers from MIT up in Boston that were shuttling down to New York to help us work on the software for the device. And so I do think this is about the agility of New Yorkers, but it's also about the inventiveness and commitment of Americans coming together, and the type of training that's happening in our engineering schools around this country that I think is really paying off for us. So I'm grateful for the city and grateful that we had the benefit of having the city invest in New Lab years and years ago, and I don't think any of us knew where we'd be today, but it's an asset.
And I just want to ask, I know our colleagues in the media will ask questions in a second, but to all of you, there is an audacity to saying we're going to make something we never made before, not even close to making before, and to do it on this timeline. And you said at first there was doubt, understandably. What helped you overcome the doubt?
I just think we all really felt this was something that had to be done. And I think there were different moments. I mean, one moment was when we had something that looked like it was working, and all the critical care physicians came down with folks from the EDC to look at where we were and give us kind of some input. And they sat with Marcel and all the engineers and gave feedback. And just seeing what they were going through and seeing how this was a glimmer of light for them gave us a real charge, gave all the engineers a real good boost when they were exhausted to push on. And I also think that, you know, that's what engineers do all the time. That's what Marcel's group at 10x Beta does. We walk up to his studio all the time with a napkin sketch and say, you think we can build this thing? That's not something that that's not a new thing at New Lab. That's something we do every day. So I think we all felt this was possible. I also really appreciate the fact that in 2010, a group of engineers led by Dr. Slocum at MIT were thinking about building a low-cost ventilator that could address this kind of problem in the developing world. And I don't think they realized that it could have such a service to New Yorkers and to this country at the time. But when we were searching around the internet for like what would be something that could be responsive, we found what they'd worked on in 2010. And a close friend of ours, Saul Griffith on the West Coast, weighed in with us and said, yeah, I think that's the one. We all kind of triangulated on that device, and then we reached out to the folks at MIT, and I think they had started mobilizing 3 or 4 days before, and then it became a round robin of sharing and kind of cooperative competition between lots of engineers, and so they were really amazing, and I think the whenever we hit roadblocks, we'd call other folks at MIT. When they did roadblocks, they called us. We built some hardware devices for them that they brought back up there. So it was a lot of real kind of competitive cooperation between a lot of really smart people. Yeah.
I love that, and it reminds me of things we've seen in different movies of folks racing against time to come up with some solution, but this is real life. This happened here and now, and the fact that you were so inspired when you heard from the healthcare professionals what they were trying to do and the people they were trying to save, and that moved you to even higher levels of inspiration and action. I mean, that's very, very powerful. And I just have to thank you so deeply for sticking with it, no matter what. And I want to see Marcel or James, if you want to add, you're more than welcome. We appreciate so much.
Yeah, excuse me, thank you. I think all of us were sort of, intimidated by the complexity of a full-scale ventilator 6 weeks ago. And then 4 weeks ago, we realized that, listen, put that aside, find a solution. And I think that the beauty of this bridge ventilator is that it replaces a hand that's squeezing an ambu bag or a resuscitator bag. That's an existing process in the clinical care stack. And what we learned in the last 4 weeks is that the hand is a very complex neuroskeletal muscular system trained by a brain. So we try to replace all of that, not just the mechanical function. And that's why this stands head and shoulders above most other bridge devices out there.
Well done. Well done. James, you want to add?
I'll just say it was Scott described it well. It was a process where there were a lot of days of doubt. There were moments where, I would call Mitch, Dr. Katz at the Health and Hospitals and say, how soon do we need these? Do we need these tomorrow? And he said, I have 5 more days. You have 5 more days. And then I would call Scott and say, okay, we have 5 more days to perfect this device. And it was a day in, day out thing. And fortunately, the day never came where Mitch said we need these tomorrow. But it was a constant process where they were working to make the device better and better, to be more functional every day while we were watching the clock. And that was... and there were times, I think, when all of us felt like this would never come together, and it's just an inspiration now to see this device here working, to have seen it at hospitals already with doctors in clinical care settings. So it's just a tremendous inspiration to see these folks and the team at EDC. Frankly, it's a team of over 20 people who a month ago didn't know what a PEEP valve was, and today can tell you all about the different components that are necessary to construct a device. And we're just honored to be a part of this team. And I think it's an inspiration, and just as you said, an example of what it's possible for New Yorkers to do when they believe in something. We have an amazing creativity in this city, and it's amazing to watch.
Thank you, and well done, James, you and your whole team at EDC and all our colleagues who did this amazing work. And please thank your teams and all those folks who spent all those long hours and everyone they consulted with. It was an extraordinary group effort. So the fact is, to the point James made, that I was on a number of those calls with Dr. Katz too, and it really was coming down to a matter of days.